11 Mecklenburg County leaders updating the coronavirus status in the Charlotte area. Health Director Gibby Harris says we're in the middle of a COVID surge from Thanksgiving. Average daily cases, percent positive cases, and hospitalizations are all up from November. The county is recommending you try to avoid holiday travel next week and limit contact with people you do not live with.
The good news right now, a second COVID vaccine could be in all North Carolina counties by Christmas. Moderna's vaccine is under the FDA microscope this week. It comes as Pfizer's first doses have just started going out to frontline healthcare workers in both Carolinas. Vanessa Rufus found out why it's so important to them to get their shots.
When it's my turn to be vaccinated, sign me up. I'm ready.
An emotional time for South Carolina doctor Janie Soriano, dealing with the devastation of the COVID-19 hospital surge.
A lot of us haven't seen this amount of death in a long time.
But there's hope, too. A long-awaited weapon in the pandemic fight. And Soriano is ready to take up her arms.
Do whatever I can to protect myself, protect my family, and to protect this community.
While the first Pfizer doses went out Monday to frontline healthcare workers across the Carolinas, there's even more hope on the horizon. A second vaccine awaiting FDA approval. An advisory panel will discuss Moderna's candidate Thursday. Doses could roll out shortly after. In fact, North Carolina health officials say 175,000 Moderna shots could arrive next week.
Some of our smaller local health departments, for example, we are definitely targeting the Moderna vaccine. It is a little bit more portable than the Pfizer.
The smaller vaccine packages and less need for ultra cold storage expected to allow more widespread shipping across the state, with all 100 counties having some vaccine by next week's end. More welcomed news for Soriano, each shot breaking down another piece of the pandemic wall.
We have to have courage and we have to have faith that we will all get through this.
And we can get there. But health officials warn that full vaccine access might not come until late spring. And until then, they urge folks to be extra vigilant as COVID-19 metrics across the Carolinas are at some of the highest levels of the entire pandemic. I'm Vanessa Rufus reporting. Back to you.